Sit down. If you notice my setup, what I like to do is set it up so the doctor has access to quite a bit, okay? Although I did it a bit in reverse, I would like this to stay closer to me. The first thing you're going to do is cut.
Keep the doctor in.
Okay. Now I don't want to cut through, well I guess I can. I'm going to use these to kind of show you what I'm doing, okay? So anyways, we would cut here, expose the hand. Okay, here we go. Now if you guys can bear with me a little bit, okay? So we would mark the skin here. Okay, that's right there.
Okay. On the palm.
Bovie may or may not be used. Some use the bipolar forceps with it, and then we're going to cut. Okay, just like that. Right there, okay? I'm not really going to do it. So we'll just say that's the skin, and that's exactly what it's going to look like, okay? So in there, there's a, what is it there? What is that called? Anyone? We have a rubber band, or like that 15 blade deal. Okay. So you got the median nerve, the ulnar nerve. That's what you want to look out for, okay? But ultimately what you want to do is, if you can see this as your ligament, okay? In your hand?
Yeah.
Or let's say, see this as your ligament? And what happens when you do this, okay, and you get carpal tunnel, is we'll call this scar tissue. And it goes around it. And it squeezes it real tight. Does this make sense? Okay, so now it's in your hand. Right?
Scar tissue around the ligament.
So now you can't do anything. You can't even squeeze, it hurts, it's just compressing that the nerve and the ligament there, so you don't get no kind of mobility, right? So you got to release that. And it's just like that, it's just that simple. So we'll say if that's around here, all we're going to do is go in and cut right on top of it, okay? And then, do we have the sen retractors?
Sen?
Mm-hmm. See if Joanne knows are there. They were over there.
Over there?
They were over there, yeah.
So they only cut the top, did they?
No, they'll go inside.
Would they take out the whole scar tissue?
No, they don't even take it out. They don't take out anything.
They just release the nerve out.
The carpal ligament.
Sorry. This is a sharp pen.
It's fine. Doesn't matter. So we're going to say we have two here, okay? So you're going to hold one there. Be careful, that's a sharp end. And we'll say you have one on the other end, okay? So all we're going to do is release the ligament. So there's a couple different ways that they can do it, okay? And there's one that's just this simple. Now it's really hard, but what I want you guys to see is, see this as the ligament, okay? See this as the scar tissue over it and around it, all right? And I made my incision.
Can we look up a video, a YouTube video of it?
No, it doesn't matter if you want to be able to compare it. We'll come out with that. We're going to say it's just like this, okay?
There's another one.
And then this is the skin, okay? So we've cut through here, right? And if you want to look at it so you can compare later, you can.
Okay.
So we've cut through here, right? And now we've exposed this, okay? And we'll say we still have skin on this end, and we have skin on this end. But we still have to release all this in here. So while he's retracting here, just hold it there, don't pull it. And here, okay, there's a couple different ways you can do it. You can take your mets, or you can take the sharp iris, and what you want to do is go in here and just release this. You see the towels? So you got to make sure you're not cutting the ligament. Does that make sense?
So the towels with scar tissue?
Yes. Okay. Another way that they can do it is they take the Mayo scissors and the back of an abscess, okay, and they just do this because it gives them an approximate amount to release without damaging anything else. And all they do is just push, and and it just rips. And they come back on the other side, and just, and that is literally the procedure.
They don't pull the scar tissue out?
That's it. Nope, they release it.
Why is it there?
It's like a vein transposition in a sense. If there's a vein that's buried too deep in the subcu, they go in, they open up all the tissue, they pull that vein superficial and place it back and then right underneath the skin. Okay? That's all they do. Does it make sense? It's really hard to explain.
Yeah.
Huh?
When does it
It
go
may.
back?
It may.
Why wouldn't they remove the
Dr.
scar
would suture
tissue?
it closed, right?
What's that?
Or is that Dr. Preference?
No, yeah, they'll suture it closed. You'll use one stitch generally in this, and it's like a 4-0 nylon, and you'll do interrupted. Some throw a little baseball stitch in there and make it look nice. Some use Proline. Generally, it's just 3-0 or 4-0 nylon, PS2, and you do an interrupted suture, maybe about 5 or 6 rows, and that's it. Okay? Why they don't remove it?
Yeah, so
Yeah. There's not much to relieve. I mean, how are they going to do it? You've got the nerves in there and the ligament that you don't want to cut. There's just too much risk. Releasing it is automatic pain. It's instant pain relief and mobility. Imagine having pain when you do this, and then all of a sudden just being able to do this. Whoa. That's it. And I'm not going to say that the doctors won't remove it. It's just such a small area. It's just really not worth it. I mean, when you see it, it's a very clear procedure because there's no blood, and you'll literally be face to face just like this. So when you see it, and hopefully you can kind of retain how I showed you, which is not too good, but you'll know what I'm talking about. Because there's a little bit of sub-Q in there, right? And then you'll even hear the scar tissue when they're cutting it. And you'll see it. It's in there so tight that when they're cutting, it actually releases. You know, and if you were the one in there cutting, you can actually feel it. And then they'll pull the fingers up just like this. Well, good. Bring it over here, and then we can all look at it. Yeah. And then they have an endoscopic carpal tunnel, which is pretty cool, but just a basic open carpal tunnel release.
Did you put it on the center?